back. Now let's get into today's video. So today will be very interesting, and I hope you enjoy today's video. So today I'm going to address some questions in our DMs and in our comment sections as well. So I have with me very interesting questions, 5 powerful and strong questions that I'm going to be attending to today. So please stay with me as we get into today's video, and I hope you enjoy today's video. The first question on my list is UTI sexually transmitted? So the person wants to know if UTI can be transmitted through sexual activity. So to answer this question, UTI is not sexually transmitted. So UTI is not sexually transmitted. It's typically not a sexually transmitted infection or disease. But in women, let's use women. Our urethra is closer to the vagina or the genital. So the distance from the vagina to the anal area is very short in women. So frequent sexual activity can contribute in the sense of introducing bacteria from the anus or the anal area to the vagina or to the urinary tract. So frequent sex through sexual activity, one or the partner might bring out bacteria from the anal area into the urinary tract, which can cause urinary tract infection or disease. Yes, so UTI isn't typically a sexually transmitted disease, but frequent sexual activity can put you at risk of contracting or getting infected with UTI or urinary tract infection. I hope I've answered your question. And if you want to know more about UTI, there is a video on UTI on our channel. Please visit our channel. Make sure you subscribe and go there and watch the full video on UTI. But I hope I've answered your question whether UTI is sexually transmitted or not. Let's go to the next question. So the next question says, can UTI kill? Very dicey. Can UTI kill? Of course. When UTI is left untreated, it might extend. So there could be a dissemination of infection to the nephron, which can cause them pyelonephritis, which can cause kidney damage. Both kidneys can damage as a result of UTI. When UTI is left untreated, it can cause serious medical condition like sepsis. When the bacteria causing the UTI is later found in the blood, can cause very serious medical condition. Septic shock, which is deadly or emergency medical condition. Sometimes we interchange the meaning of sign and symptom. So symptoms is what you, the patient, you watching me, perceive. I have my stomach aches, I have headache, this and that. But a sign is what the clinician or the physician or the doctor perceives. So a sign could be the doctor perceiving that you have a high temperature by measuring higher or lower blood pressure and so on. But the symptom is what you feel. What you feel. My stomach aches, this and that, blah, blah, blah. But a sign is what the doctor perceives. So, but both are very important in diagnosing. Very, very important. So one might come to the hospital with, I have headache, I have this and that and that. So by your symptoms you tell the doctor also perceives and check your temperature. Oh, okay, you have a high blood pressure, your temperature is high, checks your BP is high, this and that, and puts all things together to diagnose for laboratory tests and treatment to be begun. So that is that. So symptoms is what you, the person, perceives. So what I am feeling, and no one can see it. I'm having a headache. You can't see the headache, I'm having a stomach, can you see? No. So these are the symptoms, the things we perceive for ourselves, we the patients, and the sign is what the doctor will see. Your temperature is your body is hot, your temperature is high, I've checked your blood pressure, it is high, this and that and that and that, you did a scan, there is a cyst. All those things are the signs, but the symptoms is what you perceived for yourself. I hope I have answered your question very well. Now let's move to the next question. So the person is, what is the compatible genotype? This is very important, and I think it's one of the WHO's goal to Ghana Health Service goal to worldwide to eliminate sickle cell or SS patients as well. So genotype, but let me just answer the question, and we talk more on genotype and sickle cell in our next video. So let's get straight to compatible genotype. So if you are AA, you can marry AA, or you are compatible with AA patients. If you are AA, you are also compatible with AS patients, a carrier. If you are AA, I repeat, you are AA, you are compatible with AA, and also compatible with AS. But if you are SS, you can't marry AS. AS can't be together. AS are not compatible. AS and SC are also compatible. That is AA and SC. So let me get it first. Let me get it once and for all. So AA and AA, very, very compatible, perfect match. AA and AS can also be compatible, or are also compatible. AA and SC are also compatible. They will all bring offspring of carriers. But SS and SS, no. AS and AS, no. SS and SC, no. So the compatible genotypes are AA with AA, AA with AS, AA with SC. Yeah. So these are the compatible. There are other genotypes. We have D and E, but the common ones we have is the AA, AS, SC. So these are that. All right. Now the last question is, are genotype and blood type same? Okay. So blood type or blood group is different, but every blood group has a gene. So in our next video as well, we're going to talk about blood group and its genes as well. But the genotype is different from blood group. Blood group includes blood group A, B, O. Yes, A, B, O, and AB. Yes, then we have the type AB negative, AB positive, O positive, O negative, B negative, and A negative. Yes, as well. So it's different things. So genotype is different from blood group. But in our next video, I promise you, we're gonna talk more about what blood group is and what genotype actually is. But they are two different things. Yes. All can be found in the blood. Yes, both can be found or determined in the blood, but they are two different things. I hope I've answered your questions so well. So these are the powerful and strong questions that came from our followers and our dear ones, and I hope I've answered you enough. Thank you so much for staying with us, and make sure you keep your comments and your questions coming. I told you earlier on that we read them, and yes, we do. Keep them coming, and have a nice day. See you same time, same day. Make sure you subscribe and you follow us on our socials at Health Talk with Fifi, and subscribe on YouTube at Health Talk with Fifi. My name is Adjoa Dumansa. It's been Health Talk with Fifi. Bye bye.